So, good day everyone. I'm Elder Himina Pulias, your assisting nurse today. So, for today's video, I'm gonna performing the cardio upper extremities. So, here are the tools and equipments needed in the assessment. So, pair of gloves, alcohol, and the stethoscope. So, next, provide privacy for the client or the patient. Then next, we're going to perform the hand hygiene, and after that, wearing of gloves. So now I'm gonna wear the gloves. Oh, wala. So, ma'am, I'm Andres Tobias, your assistant nurse for today. So, today I'm gonna assess your cardio, upper extremities, and abdomen. So, is it okay with you, ma'am? So, what's your name, ma'am?
Adeline.
Okay, ma'am, Evelyn. So, shall we start? Okay, so first I'm gonna check your upper extremities. So, I'm gonna inspect. So, as I see your upper extremities, so there seems to be no swelling and lesion of your upper extremities. So, next ma'am, I'm gonna palpate your pulse and the radial arteries. So, is it okay with you? So, feel the pulse of the patient. If the pulse of the patient is equal, beating equal. Okay, so I can feel the pulse of the patient beating equal. So everything is normal. So next ma'am, I'm gonna check your skin turgor. So is it equally with you? Okay, so can I check? So I'm gonna pitch it and I will see how fast it goes back from brother. Okay. So the response is very fast. It goes back fast. So the other side of your hand. Okay. So the skin turgor of the patient is normal. Okay, so check the capillary field by pressing down the nail. Okay, to the other side. So do like this in 2 seconds every nail of the patient. So, do you feel any pain?
No.
Okay, so everything is normal. So, next, we're gonna look at the range of the motion of the fingers on hand of the patient. So, can you do like this, ma'am? Okay, so as I check the hand and the fingers of the patient, so I don't see any abnormalities to the hand and the fingers of the patient. So the fingers are not bent like this, like that, like that. So everything is normal. And next, palpate the bronchial artery, which is found in the bend of the arms. So is it okay with you, ma'am? So palpate. So under the arms. So position and palpate. This. Do you feel any pain? No. Okay, to the other side now. Do the same to the first Do you feel any pain?
No.
Okay, so the patient didn't feel any pain and everything is normal to the patient, and the bronchial artery is okay and fine.
Go.
So next, we're gonna test the muscle strength of the patient. So can you squeeze my fingers, ma'am, as hard as you can? Okay, it's good. So next, can you push me up against your hand? And okay, push me, ma'am. Okay. Okay. So next, we're gonna check the, or we're gonna test the fingers and hand of the patient underneath to check the drip. So can you place that, ma'am? And close your eyes. Then until 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. So the patient hand is steady. The hand of the patient not goes upward. So the patient has no drip and everything is normal. Okay, so let's proceed to the cardiovascular examination. So, good day, ma'am. So, I'm looking at the notes here as nurse today. So, let me know your name.
Adelina.
Okay, ma'am, Edeline. So, shall we start? Okay, so first, ma'am, I'm gonna ask you to breathe normally. Okay, so the patient can breathe perfectly normal. So next, I'm gonna let my patient to raise her hand, and can you raise your hand and arms forward? So can you flip it over, ma'am? Okay, so okay, so I don't see any abnormalities of the hand and the fingers of my patient. So next, ma'am, I'm gonna ask you to bring your hand together and make sure the two nails are stick together. Okay, so I will inspect first. Okay, so it's good. So as my explanation, so her fingernails are not too big and she do very well in what I said. So again, ma'am, can you raise your hand, arms forward? So this time I'm gonna check your arm temperature. Is it okay with you?
Yes.
Okay, so the arm temperature of my patient is normal. Okay, so check the capillary feel by pressing down the nail. Okay, to the other side. So do like this in 2 seconds every nail of the patient. So do you feel any pain?
No.
Okay, so everything is normal. So next, I'm gonna check the pulse of the neck of the patient using the stethoscope. So is it okay with you, ma'am?
Yes.
Okay, so I'm gonna start checking the pulse neck of my patient. Can you take a deep breath and hold it for me? Okay, to the other side. Okay, so as I check the pulse of the neck of the patient, so I can feel the pulse and while she's breathing. So next, I'm gonna check the carotid pulse of the patient. So is it okay with you, ma'am?
Yes.
Okay. Start to the side. The carotid pulse is located at the neck of the patient. Okay. So I can feel the pulse on the side. To the other side. Okay, so I can also hear in this side. Okay, thank you. So, as I check the carotid pulse of the patient, so the pulse is not beat so fast, so it's perfectly normal. So next, I'm gonna assess the jugular venous pressure of my patient. So I will command my patient to turn her head to the right side. So that's already 45 degrees. So I'm gonna assess now her jugular pressure, which is located at the neck. So this is the jugular venous pressure. So let me ask, ma'am. So do you have a stomach ache or anything?
No.
Okay, so can I press down your stomach? Okay, thank you. So now I'm gonna ask my patient to lift her arms. Okay, ma'am, can you lift your arm, one arm first? And I'm gonna inspect. Okay. Can you down, ma'am, and to the other side? To inspect the lateral area. Okay. There's no problem. It's okay. So next is I'm gonna palpate the apex beat of the patient. So is it okay with you, ma'am?
Yes.
Okay, so next is I'm gonna assess for external heat. So is it okay with you, ma'am? So in this area, I can feel the beat of her heart. So it's not too fast and it beats normal. Assess for trills across the four valves. So is it okay with you, ma'am? Okay. Okay, again I can feel the heartbeat. Okay. So now I'm gonna start auscultate the four valves. So is it okay with you, ma'am?
Yes.
Okay, so in first, I'm gonna use the diaphragm of the stethoscope. So the first valve is the mitral valves, which located in the fifth intercostal space. Okay, so the second valve is the tricuspid valve, which located in the fourth intercostal space. Okay, so the third is the pulmonary valve, which located on the second intercostal space at the left external edge. Then the last valve, which is the aortic, which located at the second intercostal space at the right external edge. Okay, so I'm gonna repeat the process. So now I'm gonna use the bell. So first is the mitral valve, fifth intercostal space. Second is the tricuspid on the fourth intercostal space. Then next is the pulmonary valve on the second intercostal space at the left, external edge. And the last is the aortic valve, which is located at the second intercostal space at the right external edge. Okay. Turn side. Can you turn side, ma'am? Okay, so this time I'm gonna check her first crackle, so it's located at the lower back of the patient using the stethoscope. So now I'm gonna listen the crackle sound. So as I check her crackle, first crackle rather, so I can hear a crackle sound and I can hear a squeezing, like it's bubbling like water. So next I'm gonna palpate the lower back of the patient. Um, so is it okay with you, ma'am, to palpate your back?
Yes.
Okay, so to the inside. So ma'am, Edeline, so we're done with the examination or assessment with the cardiovascular. So thank you for your cooperation, ma'am. So I'm gonna get the documents first for your summaries of findings. So in summary of findings, so I performed a cardiovascular assessment on Miss Edeline Hackett, a 22 years old female. Based on my inspection, she had no peripheral stigmata of cardiovascular disease, and her pulse was regular and palpation. So she had no hicks or trills on auscultation, and she had a normal on first and second heartbeat sound with no added sound. And this was a normal cardiovascular exam or assessment. So thank you, ma'am, and good bless. Okay, so we're done with the assessment, so I'm gonna remove my gloves. And throw to the garbage if necessary, and after that apply the alcohol. So once again, I'm Nurse Elder Janina Pundias, your nurse, and thank you for watching.